All right, everybody, welcome back to the group anniversary report. Now, I like to present these group anniversary reports during a clinical time. And that means I'm not adjusting patients. So I will typically do this in the late morning on a Monday or in the early afternoon before my prime time. Now, once a month, for those people, the patients that cannot make it during your day, you can have it in the evening. And this is one of the reasons why we perform the anniversary exam for adjustments prior to the group anniversary report. Now, why do we do it in group? Why don't we do it individually? Well, our research has shown, this is called the herd mentality or the restaurant syndrome, that people tend to do what other people do. You're also going to save a lot of time by doing it in a group setting. I used to have days of 25 people, and we're going to share with you a technique in the individual one-on-one on how we can actually get patients on for over 1 year of care. Now, the group anniversary report PowerPoint is in the next presentation, as well as the script. Can you add to these slides? Absolutely. Can you subtract? Absolutely. The key is redipping or re-educating your patients onto the big idea. Just as we do monthly Transform Power workshops, just as we have a doctor's report, really this is the end game at the end of that 3, 6, 9, or 12-month care program, whatever program you have your patients on. Now, it doesn't matter if they're initial intensive care, if they're corrective, or if they're on their 4th or 10th year of wellness care. I highly recommend that you get your patients back into this group as much as you can, especially those patients finishing that first block of care. So they can be acute, or they can be corrective, or they can be wellness. We're going to bring them back, and we're going to go through 10 steps. So if you have not downloaded my cheat sheet, it's at the very end. I want you to hit that pause button, go download it, come back to this presentation, and I'm going to walk you through at least 10 key points that you want to hit home with when you do this presentation. So the very, very first one is to welcome and acknowledge your patients. I just want to thank them for being under care in my practice, either for a short term or long term, and let them know that the majority of my patients do enjoy some sort of wellness care, just as I enjoy wellness care on a regular basis. And I have no challenges letting my patients know that I get adjusted at least once a week. The point number 2 we want to touch on is that there is a wellness revolution around the world. That people are exercising, they're eating organic, they're drinking spring water, they're into meditation. Let them know that, and people will start to agree with you. Yeah, because the idea of the anniversary report is not just to educate, it's to transform those patients into wellness care. Then I'm going to get into the role of the nervous system and the importance of normal brain-body communication free of subluxations. I'm also going to talk about health, wellness, and the general adaptation potential. That means if you're eating right and you're exercising, and if you're embracing that sort of triad or the 4-dimensional model of health, your general adaptation potential increases, which means your body's better able to adapt to stressors in a stressful environment. Point number 5, and put a star beside this one because this is the most important one that you really got to hit home with, is the brain-body diagram. And what I want to stress with this is that the body is always in a breakdown process. So very similar to plaque building up on the teeth, and I will use that dental analogy, patients understand that they've got to brush and see their dentist on a regular basis. So what I'm going to talk about is how the body breaks down, how stressful situations that are physical, chemical, or emotional can cause subluxations, and occasional adjustments from once a week to once a month are required to keep the body subluxation free. I'm going to talk about the subluxations and their causes. I'm then going to get into spinal decay, and this is especially important if you're using a biophysics protocol, such as PSC, CBP, or Pedibond. If you're making structural changes and that curve is slowly coming back, chances are it's not completed after the first 3 months or the first 12, and that there's ongoing need for correction. And if you're using a neurological model like CLA Substation, you're going to see neurological changes that our research is showing can take as many as 150 interventions before that patient is textbook back to normal. The next key area is the benefits of wellness. Why would they want to continue on wellness care? Well, you really want to use the slide that talks about the benefits, which include better sleep, better immune system, less stress, less need for medication, hospitalizations, visits to the doctors. I mean, we can talk all day about the benefits, but really hit home why they're investing in their health. The last 2 points, you also want to talk about the Transform Power workshops. If your patients haven't engaged in those workshops on a monthly or at least a quarterly basis, re-invite them back in, because most people are through that sort of structure and function model. Now they want to embrace more nutrition and wellness or whatever ancillary services you offer. And then the very last point, point number 10, is I really want to ask for referrals. Letting your patients know that your practice still accepts referrals. And that if they know of anybody that would benefit from a chiropractic checkup, please refer. Now, on our next training video, I'm going to show you how we then take the patient back into an individual one-on-one report. This entire group report should take no longer than 10 minutes, 15 max. And then we're going to take that patient back in a closed room and go over their findings and introduce them to Wellness Plan 1 with the default as far as a Wellness Plan 4. I'm going to show you how we do that for 95% conversion into wellness care. So hopefully you've made copious notes and you're ready to smash your anniversary report out of the park. I'll see you in the next training video and show you how we do the individual one-on-one. Thank you.